My name is Imran Ali. I'm a postdoc here in the Blum Center. I'm an environmental engineer by training, and my work deals mostly with safe water and public health in slums and in disaster emergency scenarios. So I was like a math and science nerd in high school, right? And I remember we had a session with like the counselor who's like, okay, if you want to go to university, if you want to get into these certain kinds of programs, these are the classes you have to take. So I'm like, I don't want to make a decision. I'm like 17. So I'm like, I'm engineering. Okay, you need to do the most courses. You have to have the most science and math courses and everything else. So if you get into the engineering courses, you have everything else open to you. So I'm like, okay, I'll just aim for engineering, and that way I can get into anything else when I decide. So I went to university and I did engineering. And to be truthful, I didn't really fully understand what engineering was. Even when I got through my undergrad, I was like, I'm not really sure what, I can use some math, I can use science, we build and design things, okay, but I still didn't have a complete idea what engineering meant. It was kind of nebulous, you know what I mean? What drew me into this kind of work, like, I was really drawn to environmental problems, right? And I wanted to contribute to some kind of solution to the environmental crises that we were becoming really articulated in that late 90s period. So I set off working on those things, but what I found is that what was underneath that drive for the environment was a concern for human beings. It was a concern for like people's welfare, right? It was for like how do communities and societies survive inside an environment that's increasingly getting harder to exist in, right? So when I kind of like tried to unpack them, like what I'm really interested in is people's well-being, public health, things like that, right? So I had this training now of engineering. I did environmental engineering from my undergrad. So I was really interested in water, and I was always really drawn to water. I don't know what it is about it. Just like, I used to just stare at my old Nalgene of water and be like, this shit's so beautiful. Look at it. It just kind of flows around. So it was like this some kind of poetic connection to water, right? And I knew the water had massive public health relevance, right? So my family is Pakistani, so I was born in Toronto, but I used to go with my family to Karachi when I was younger a lot, right? So we'd often go in the summer, which is when the monsoon rains come in Karachi. So when the rains come, everything floods in Karachi. And the area that we lived in had a lot of open sewers. So literally between two major roads, you just had a sea, like a stream of shit. Right? It was disgusting. And to cross the street, there were like these like concrete planks you had to walk over, right? I still had bad dreams about falling into those things. But when it would flood, those open sewers would flood everything, right? So like we were okay because we had like my grandfather had a house. Everything was elevated. It wasn't, it stayed out of the water. But there were a lot of like slum areas nearby, right? And those areas become inundated with the sewage water, right? And you're like, this is messed up. Right? And when I would go to Karachi when I was younger, I'm like a food fanatic. So like I'd be out in the streets all the time, like, yo mom, give me some rupees. I'm gonna go drink some of that sugarcane juice. I'm gonna have some of this chaat. I'm gonna have these samosas on the street. I just ate everything I could find, right? But the problem was during the rainy season, there's a lot of it's poor hygiene, right? And it turns out that the sugarcane is often washed in the rivers. And the rivers are, of course, receiving bodies for all this sewage and runoff and everything else. So I got like typhoid when I was young. I got malaria when I was traveling. I got hepatitis A when I was young from drinking so much sugarcane juice and eating stuff on the street. So all these waterborne diseases. So I was seeing it, people are exposed to it. I was feeling it. So it took on this really concrete relevance to me. Right? And then of course, later on, as I learned about like, the numbers, the United Nations projections, like this is the diarrheal disease burden, and this is, the number of disability adjusted life years. You start seeing that, this very concrete experience that one has is tied to larger systems and larger processes, right? So I was like, yeah, I'm going to work on that. This question of water supply in people's households is not a technical problem. And we as engineers, when you're a hammer, everything looks like a nail, right? So we're like, this is a technical problem. I'm going to throw some science at that. I'm going to do some filter column experiments. I'm going to make the perfect system and just give it to people. And we did that. And we gave it to people. And people were like, that's nice, thanks. You know, like maybe like 10, 15% of them actually used it. And who knows for how long, maybe for a couple months, right? It was very labor intensive. It was basically a 3-stage bucket filtration system, right? Very laborious to use. Like you had to like actually wash out the sand after it got, you know, clogged up and everything else. You had to like dose chlorine to purify it. So people stopped using it. But you know, it's funny because when we were doing this research, I've been hearing a lot about like participatory development, you know, human-centered design. So I was trying to bring all these themes together into like the engineering design process, but I hadn't fully integrated it. That's why we got this kind of very technical kind of solution. But when I was doing these, I was doing a lot of like focus groups and interviews, like a lot of like social sciences type research to find out what the story of water was in this particular community. And people kept on telling me like, you know, getting water here was, you know, we had to like agitate. First of all, these people in this community they're development displaced. So they were removed from a central part of the city of Chennai to the very, very outskirts to make room for this rail system that the city was building. They were moved there without any kind of like resettlement. It was a swamp that had been infilled, put some light posts up, and that's it. People were just dropped off with like 1,000 rupees in their pocket by truck with their belongings. So they had no shelters, no water supply, nothing in this place. And it was so far away from the city, no buses, nothing. They lost all their jobs. You know, people like were near to starving in this place, right? So they were hella upset about this, right? And they say, you know, when they were telling us they're going to move us, we were going to get this, this, and that, and none of it came. So what did we do? We blocked the road. We agitated. We politically organized to demand our rights, right? So they kept on telling me, like getting the water supply in the first place. First of all, there was no water supply, right? There was a big fire in the temporary settlements, and people died in that fire, and people were really upset. Like, there's no water. We couldn't fight this fire, so we blocked the roads. We, you know, went to the government. We banged on their doors every day until they built the water supply system, right? And then every subsequent phase after that of how it elaborated and improved was through political struggle, right? So people are telling me these stories, but I'm coming at it from a very technical background. I'm like, okay, that's nice, that's the story, but tell me more about like, what's the problem with the water? Is it taste? Do you prefer using a column? Do you prefer flocculating? Do you prefer chlorine? Like, I was very much focused on just a technical menu, right? But there was this whole other story underneath it about how people get access to resources, right? How people struggle to get their rights, right? Which I wasn't hearing. It was in that process that I began to think about like, what is a role for an engineer working on these like contested spaces of resources, right? We can just come in and drop, you know, water treatment system at the household level, the community level, that's fine. But it doesn't address like the root political causes that yield a certain condition where some people have access to water, but some people don't, right? So the question for me became, how can we as engineers support people in their resource-related struggles, right? And that was not at all my PhD work. I just kind of learned a little bit about it on the side while I was doing still my relatively technocratic kind of research, right? In the end, my PhD dissertation was about developing a decision-making support tool that NGOs, community groups can use to design an appropriate safe water system. So that has technical aspects, but also went into like, what is a social capital within the community? What is the relationship with the government? What are the institutional conditions in the community? Like, what's the land tenure situation like? So all these things feed into what kind of system might be appropriate. So I was kind of getting at it, but I didn't get quite fully there. A big problem, especially in the water space, is that in this like contemporary moment of like expanding neoliberalism, there's a pressure to download services from the government to the public. And water is a perfect example of that, right? Like, once most people in India get water, they get water in bottled water. People who can afford it, right? The people who can't afford it are stuck with the public water supply, right? But because most people who are wealthy enough and have political access are drinking their own water supply, they're not mobilizing anymore for getting cleaner water, right? So you see this kind of breakdown of this social obligation to provide safe water, and a breakdown of the political obligation to do it, right? So we're implicated in that as engineers. Like, when we work on household water treatment systems, we are acknowledging that it is no longer the government's responsibility, it's the individual household's responsibility. We are now part of that neoliberal program. You're facilitating this transfer of responsibilities. So I think we need to be aware of engineers, like, our projects, we see them as only technical, but they're embedded within political economic systems. So what kind of processes are we reinforcing? That's something we don't think about. So we should certainly think about that. And once we think about it, then we can be like, okay, well, that's not good. I don't agree with that. So then what's an alternative? What are technical projects or tools that we can use that have a different kind of political arrangement behind them? Our training as engineers is so expansive. There's so much to learn, right? In the core sciences, in mathematics, and applying them, right? That we have very little time to think about other things, right? So this is a serious constraint upon us, right? What that means is that because of our training is very focused on the technical aspects, we see everything as a technical problem. But nothing is a technical problem. Everything is a political, economic, social problem, issue, concern, right? So we need to find spaces in which we can train ourselves, to see the world through a political lens, to see the world for social hierarchy and processes, right? Until education catches up with us. And I think that's one of the cool things that's happening in the Blum Center, is they're trying to bring these disciplines together so we can have training spaces where people can see the world through multiple lenses at once, right? Once we're able to see, it's kind of like the Matrix, like you can kind of see like the political structure behind what you're doing, right? Once you can call it and name it, right, then you can move away from it. Then you can imagine another possibility, right? So I think we need to be very deliberate about the systems in which we work. We need to name them, right? We need to know how we are fitting into them. And then, we can accept neoliberalism, right? But we should be able to call it that, right? We accept the state has less obligations or is incompetent, therefore the individual should do it. But we should call it that. And if we don't agree with that, then we can create a different kind of paradigm in which to work, right? Well, I think that every engineer should be a socially engaged engineer, right? Because the work that we do has such massive impacts on everybody's life, right? And oftentimes I read somewhere that engineers are kind of like the mercenaries. We do the bidding for whoever is the highest bidder, right? And that means that people who are dominant set the terms and we just fulfill them, right? So whether we like it or not, we are political actors, right? But we should certainly be aware of what kind of political actors we are, right? And if you're not comfortable with the role that we are imposed into by the structure of the economy, by the roles of engineering in traditional firms, then we should make a willful decision to move away from that, right? So every engineer is a socially engaged engineer, whether they like it or not, whether we know it or not,